This is Chris Landrigan. I'm the principal investigator of the IPASS program, and I want to share with you a virtual immersion learning tool that we developed in order to help scale the program. The way that our program works is we begin with a very brief introduction to some of the didactic elements around handoffs, the frequency of medical errors, the nature of communication problems in the American healthcare system, and then very rapidly bring learners to a place where they are rating live videos on the computer, as you can see here. As this video proceeds, the learner is asked to keep track of what's good and what's bad about the handoff, and they'll then be moved to a couple of screens where they rate those things, and their responses are compared against some gold standards. In a similar vein, they're then taken into the heart of the training module, which is to actually conduct a live handoff and to synthesize a handoff that's given to them in a 3D virtual environment. They're dropped into this 3D environment where they learn about a patient who is coming in at the beginning of the shift, named Peter Smith. You can see him coming through the doors here. And over the course of the shift, various facets of his care change, such that there is both some information from the initial admission history and physical examination, but there is also changes in care that occur over the course of the shift that have to be integrated when it comes time to do a handoff. The learner then enters a virtual computer screen here and types in a written handoff referencing the original history and physical exam as well as the changes over the course of the shift. And once they are done entering this written information, they can use that as a reference when it comes time to actually conduct a verbal handoff.
Department following a fall from a ladder, presented with weakness in his arms and legs.
After the learner has had the chance to practice this skill, they then do a self-assessment where first they divide the recorded handoff into the different elements of the IPASS format, and they then delve into each one of those elements and rate how well they performed as compared with gold standard responses that are provided really as a series of checklist questions. Did or did they not include the following elements? A very similar process is then followed for the synthesis, where the computer provides a handoff to the learner, and the learner has to synthesize the key information out of that and record it into the computer, comparing themselves again against gold standard responses. With these types of learning tools that, again, allow for the opportunity to both practice and self-assess in a safe environment, we have the ability to scale IPASS very rapidly for application across an entire hospital. Thank you very much.